Hello everyone, we are Group 6 and for our group video presentation, we will be looking at anxiety disorders. Let's start by better introducing ourselves. Group 6 includes Erica Dove, Cheryl Kerr, Eric Miguel, Sarah Murley, and Harpreet Singh. The specific anxiety disorder we will be focusing on is panic disorders. The subtopics for this include the background, characteristics or symptoms, causes, treatment or intervention, and lastly, an example of how the disorder is portrayed in society. These subtopics will help improve your understanding of this disorder.
First, let's go into the background of panic disorders. What is a panic disorder? Panic disorder is a type of anxiety disorder that causes repeat, unexpected attacks of intense fear, along with fear of having more attacks. People who have a panic disorder can have panic attacks that can last up to several minutes in length. This can happen to someone quite frequently and are characterized by a fear of disaster or of losing control of something or a situation, even when there is no danger. This can affect a person in many ways, as it has the possibility of affecting them at any time, which leads to another problem, the dread of having another panic attack. This alone can affect a person greatly, as someone with a panic disorder will feel discouraged and or ashamed to do everyday normal activities for the trepidation that they might have another panic attack if they do so. Obviously, this can have a big effect on a person, as it will affect their work and school, but we'll get more into that later in this presentation. Unfortunately, panic disorders affect up to a third of adults in any given year, but only 1 to 2% of all Canadians will have panic disorders in the same year. Overall, about 4% of all Canadians will experience panic disorders at some part in their life. There are certain groups of people that panic disorders primarily affect. Although it can affect anyone, these are the groups it affects the most. It affects women the most, as it is 2 times more likely for a woman to experience a panic disorder than a man. It has also been reported that 75% of people with panic disorder in Canada also have some other diagnosed chronic physical or mental illness, like depression or diabetes. For young adults, a panic disorder will most likely appear in their mid-20s, and 75% of all people who have a panic disorder will experience the onset before they turn 33. However, there is also a high prevalence in teenagers between ages 15 and 19 as well. Lastly, one of the biggest factors for someone developing panic disorder is their family history. People who have one or more persons in their family with a history of anxiety or depression are the highest risk for developing panic disorder.
Hi there, my name is Erica Dove, and I will be covering the symptoms of panic disorder. While each disorder that falls under the anxiety umbrella has different symptoms, they are all mainly characterized by excessive irrational fear and dread. A person with anxiety typically experiences some or all of the following symptoms: a constant feeling of being on edge or restless, overwhelming constant worry and fear, irritability, difficulty sleeping, negative thought patterns, disturbances in work life and relationship functioning, decreased social and emotional health, agoraphobia, isolation and avoidance, depression and substance abuse related disorders, physical symptoms, so GI issues, bruxism, grinding of the teeth, headaches, muscle tension, and more. And lastly, panic attacks. So just as the causes of anxiety are highly individualized, so are the symptoms. The amount, severity, and duration of symptoms can all differ depending on the individual, their environment, and the length of time the disorder is left untreated. For many, anxiety levels change depending on the amount of stress currently present in their lives. There are many internal and external factors that contribute to the symptoms and outcome of anxiety, such as support systems, co-occurring conditions, accessibility to treatment, and stressful lifestyle habits. Over time, the symptoms of anxiety can lead to panic attacks, which can lead to panic disorder, a specific type of anxiety. On the next slides, we will cover the specific symptoms associated with panic disorder. Panic disorder is a specific subtype of anxiety disorder that involves the prevalence of sudden, debilitating panic attacks that affect multiple aspects of the individual's life. So, common symptoms of panic disorder include sudden and repeated attacks of fear, so panic attacks, that can occur at any time. So, during these attacks, the individual will have a feeling of being out of control, dying, or having a heart attack, even when there is no real danger. They also may have a fear or avoidance of places where panic attacks have occurred in the past. So, often these are busy public places like schools, high traffic areas, grocery stores, and more. They will also have an intense worry about when or where the next episode will happen, and they may have a decline in overall functioning and quality of life due to these attacks, such as missing school or work, social isolation, and more. And again, there are many physical symptoms from panic attacks as well, which I will go into in the next slide. So, more of the physical symptoms of panic disorder include tightness, pain in the chest, increased in heart rate. There also will be an increase in blood pressure, sweating, numbness, and tingling in the extremities. They may have some GI distress like nausea, diarrhea, constipation. There may be some shaking or trembling, weakness, hot or cold flashes. There may also be headaches, dizziness, disorientation, or confusion. Increased respiratory rate, also known as hyperventilating. Shallow breathing, labored, difficult breathing, choking feeling. They also may have a fear of death, fainting, having a heart attack, and losing control. So some of the physiological reasons behind that is just that the brain senses a dangerous stimuli, which prepares it for fight or flight. With this, the blood vessels dilate to allow more blood flow to the tissues, which can cause the increase in heart rate and blood pressure, as well as the tingling in the extremities. Because of the sudden changes in blood rush, they also may suffer from gastrointestinal symptoms due to the lack of blood flow to the digestive tract. Also, secretion of adrenal stress hormones such as cortisol, norepinephrine, they can also be exhausting and can cause negative health impacts when the body is regularly overtaxed with stress. Lastly, panic attack symptoms can be brought on by different things. For starters, some can have specific phobias, so fear of heights, fear of a specific person. Also, some people are just brought on panic attacks in just general situations, so crowded stores, new situations, social situations. And then lastly, there is the actual situation-specific triggers, so before a presentation, before an exam, and the like.
What are the causes of panic disorders? Research suggests there is no exact cause as for why individuals develop panic disorders. However, a combination of challenging life events, biological and psychological factors play a role in the development of panic disorders. A biological predisposition to panic disorders or anxiety disorders is highly associated with the etiology. Genetics is a factor for panic disorders manifesting. As a result, if an immediate family member suffered from panic disorder, it is likely it can be passed on to future generations. Several twin studies have proven there is possible genetic inheritance of anxiety disorders. Consequently, panic disorder can also be caused by biological malfunctions, such as certain changes in the way the brain responds to fear or anxiety triggers. Recent studies explain the amygdala, a small structure within the brain, is responsible for abnormal activation of the body's response to fear and anxiety. Specifically, the presence of the NTRK3 gene is a factor for panic disorder. The NTRK3 gene increases the perception of fear, resulting in a heightened response to a sense of alarm and anxiety. The deregulation of the NTRK3 gene produces abnormal changes in brain development, which lead to alterations in the fear-related memory system. The hippocampus plays a role in the processing of the feeling, and the amygdala is responsible for the body's fear response. Together, these circuits in the brain are activated when in response to sudden alarm or fear. This serves as a communication center for the brain, which processes incoming sensory signals and interprets them. It was found in those who suffer from panic disorder, there is an overactivation of the hippocampus and abnormal activation of the amygdala circuitry. This triggers an exaggerated development of fear memories in the brain. Stressful events can also trigger panic disorders. A sudden loss, separation, or major life transitions can prompt panic attacks. As a result, when certain events or life stressors lowers the body's resistance, the physical predisposition is activated and a panic attack follows. The physical and psychological causes of panic disorders are interrelated and they work together. Several cases of panic attacks can occur randomly, however, underlying symptoms can help to promote them. Furthermore, traumatic life events, such as an accident, forms of physical abuse, and even happy events, can increase the risk for developing panic disorders. Further research involving the brain's response to fear and anxiety is necessary for scientists and healthcare professionals to understand the exact cause of panic disorders. In addition, by advancing their knowledge about the complex brain circuitry, more specific treatments can be devised to treat those who suffer from severe anxiety disorders.
And now I will be covering the treatment of panic disorder. So research suggests that multimodal treatment is best, which includes the involvement of one or more method of treatment. This applies a more holistic approach, attacking the issue from multiple directions. Doing so increases the patient's chance of recovery success, as well as decreasing their chance of a later relapse. Possible therapies for treatment of anxiety, specifically panic disorder, include psychotherapy. So examples are group therapy, grief therapy, anger management therapy, and cognitive behavioral therapy. There's also pharmacotherapy, so SSRIs, anxiolytics, and tricyclics, and these work to either increase the concentration of serotonin in the brain, the happy hormone, or they help to increase neurotransmitter concentration in the brain, resulting in better nerve connection. Also, on the next slides, I will be talking about some research that suggests exercise, meditation, mind body exercises, and diet can also play a role in panic disorder treatment. So, starting off with the most common treatment methods, of all proposed methods for treating anxiety, pharmacotherapy and psychotherapy have been proven through years of research and clinical trials to be the most effective treatment available, especially when used in conjunction. Medication can help to repair damaged nerve connections, resulting in an increase in neurotransmitter concentration and improved mood. With this improvement in mood, the patient is in a better place where they can be ready and willing to attend therapy to deal with the underlying causes of their anxiety, and they can learn how to manage the symptoms in a healthier, more productive way. When compared in studies, however, the two treatment methods have approximately the same level of efficacy. This suggests that either method of treatment is extremely effective for anxiety disorders, yet the outcome is even better if both are used synergistically. So just a quick comparison of these two methods of popular treatment. So medications, there are some pros and some cons. As far as the pros go, it requires little effort from the patient. It's easy, effective, and convenient, and it's also extremely easy to access. Some of the cons, however, are that it only lasts a short duration of time, so it's more of a short-term treatment method, and it also can have potentially harmful or unwanted side effects such as nausea, weight gain, or trembling. As far as cognitive behavioral therapy, there are also some pros and cons. The pros are that there are few side effects and that the knowledge learned in treatment lasts a significant amount of time, suggesting efficacy for long-term treatment. Some of the cons include that it can be difficult to find a therapist you feel comfortable with and can connect with. It can also be expensive if you're not covered under insurance, and it takes a lot more work and effort from the patient. All right, so continuing, this is the cognitive behavioral model of panic disorder. So just a bit of background. Cognitive behavioral therapy is a learning-based approach that changes the way a person thinks so that they perceive the world differently and behave in a more helpful way. Often, anxiety is a cyclical reinforcement of negative thought patterns. Therefore, the goal of cognitive behavior therapy is ultimately to break this cycle. It also comes with little side effects, and treatment gains are strong and generally last a long time. So, just looking at some of the diagrams below, I just want to direct your attention to the diagram on the right. It's a little more detailed. So, what happens is that a stressor occurs and the person goes into an automatic state of alarmed reaction. So they'll have a rapid heart rate, shortness of breathing, they'll feel tightness in their chest, and then they actually catastrophically misinterpret these symptoms. So instead of just saying, oh, I'm anxious, they think they're having a heart attack or they're going to faint. So after they go into the catastrophic misinterpretation, they become hypervigilant to these symptoms. So they expect more anxiety because they're feeling these symptoms, which leads to increased anxiety, which again leads to more of the symptoms. So it's kind of just like a big cycle. So again, the goal of cognitive behavioral therapy is just to break this cycle so that the patient can realize their reactions are kind of irrational and they can calm down and behave better based on that. So going into some recent research I was looking at, a 1998 study by Brooks et al. Compared the effects of aerobic exercise, placebos, and drug treatment on 46 individuals with panic disorder. After the 10-week intervention, it was found that both drug treatment and exercise proved to be more therapeutically beneficial than placebos. The results also showed that patients using both drug and exercise treatment had the highest positive effect. These findings suggest that aerobic exercise can be an important part of a balanced treatment plan for those suffering from panic disorder. These findings also support the efficacy of multimodal treatment. Alright, a 1992 study by Kabat-Zinn et al. Studied to aim to examine the efficacy of group stress reduction programs based on mindful meditation for 22 patients with general anxiety disorder and panic disorder. So the class intervention lasted 8 weeks with a 2-hour session once per week. During these classes, the participants were taught a range of different meditation techniques, and they were also encouraged to practice these techniques as homework. So the patients were assessed at the recruitment of the study, pre-treatment, post-treatment, and a 3-month follow-up using a variety of questionnaires and scales. After the end of the program, the post-test and 3-month assessments showed that anxiety and panic symptoms had significantly reduced in the participants. These findings suggest that meditation and mind-body exercises can also be included as part of an anxiety treatment plan. So just looking at some strengths and limitations of this study, some of the strengths are that they use many different questionnaires to measure anxiety levels instead of just one criteria. They also had a really good sample size and even age distribution across the population. Looking at the limitations, they did have uneven gender selection, so there were only 5 men recruited and 17 women, and also the exact amount of homework completed by each patient was never measured, so there could be some variances based on that.
The following section will cover the portrayal of anxiety disorders in the media. Anxiety disorders are the most common type of mental illness affecting Canadians. They can affect anyone of any age and have many triggers. So why are people with anxiety the least likely to seek treatment? This is a very important question to ask ourselves as healthcare providers. Studies demonstrate that deficits in knowledge surrounding anxiety disorders, as well as certain beliefs, are the main factors contributing to delay in seeking treatment and inappropriate delivery of treatment. Thus, how the public perceives anxiety disorders is a major factor impeding the effective treatment for individuals. The process of treatment seeking can be conceptualized in 3 steps: perceiving a need for treatment, seeking help, and engaging in treatment. Targeting the treatment-seeking process as a means of altering the portrayal of anxiety disorders would be a great start to improving the understanding and encouraging treatment. The media has a significant influence over the Canadian public and is highly influential in producing stigmas of individuals dealing with mental illnesses. Medical dramas, news reports, and reality television all give rise to inaccurate and harmful portrayals of mental illness. The most common stereotypes include individuals who are unable to cope, violent, withdrawn, unpredictable, and explosive. These stereotypes have the ability to overshadow the reality of anxiety, leaving the public with a false impression of what anxiety is and how it should be handled. This may skew information so much that detrimental stigmas are created, causing reluctance to seek treatment, isolation, maltreatment, and other harmful situations. The following clip is from a comedy drama, Matchstick Men. It displays a portrayal of a male character dealing with obsessive-compulsive order. OCD is a designated disorder which falls under the anxiety umbrella.
Roy? Hey, okay, I do that. I thought you there. Come on, Roy, come on, really, man.
One, two,
Hey,
three.
come on.
Take your shoes off.
What? Why?
Take your shoes off or you don't come in.
You didn't take your pills, did you? I'm taking them off. All right, come on, man. I'm taking the shoes off. Give me a break over here.
Okay.
Jesus Christ. Oh, God, what is that smell? What'd you get attacked by Mr. Clean? Come on, Roy. You gotta open the window, buddy.
No! No windows.
Okay, windows are closed. Windows are closed.
You looking for something, sucker?
Yeah. My partner, have you seen him? He's been missing most of the week. Tall, good-looking guy.
Hey, would you watch the rug? You're spilling food.
What?
You didn't take your shoes off.
Okay, I'm taking the shoes off. Okay, buddy, I'm taking them off. See, they're off. The shoes are off, okay? There you go. Oh, man, you are bad. Did you take your pills?
I spilled down the drain bags.
Oh, Roy, come on, man. Did you call me a Cuso?
Moved.
You gotta be shitting me.
That's what I said.
Okay, here we go.
All right, come on.
Let's go. Come on. It's okay. I want you to breathe. Okay? Just keep breathing. Breathe. Okay. Okay. Shoes are. There you go.
Food.
What? Okay, food's gone. I'm getting all the food. Okay? Listen to me, Roy. You listening? I want to make a couple of calls. My aunt saw the shrink after her divorce. He really helped her. He's a good guy.
Frank.
Hey, Roy, you need to see someone, okay? Don't think I'm doing this just for you. You know, you got money. You can retire. I got car payments, man. I don't need a partner who's like, My heart goes out to you, but this is it now. I got to make some money.
Frank, would you wipe that thing off when you're done with it? Wipe the receivers. Wipe it off.
There are both positive and negative aspects of anxiety representation in this clip. I will begin by mentioning that I was impressed to see that seeking treatment was encouraged. Many media pieces show individuals who miraculously recover from mental illness alone and with no treatment or support. As can be expected, this can impede the public's understanding of how anxiety should be treated and how they may find help. The clip did also represent symptoms of OCD in Roy's repetitive behavior, his fear of contamination, shortness of breath, and feelings of fear. He also had panic and uneasiness. The more detrimental aspects that were demonstrated in Roy's character in the way in which his friend handled Roy's anxiety. Although exposure and response prevention is a method of treatment for individuals coping with OCD, it is important that close friends and family members do not intentionally provoke feelings of panic. Panic attacks are serious and should be treated as such. You wouldn't intentionally bring on an asthmatic attack on a loved one, so panic attacks should be treated with the same respect and thoughtfulness as any other medical anomaly. Furthermore, although it is only briefly discussed in this particular clip, Roy's character is a professional con artist. This plays into one of the most prominent mental health stigmas that people dealing with mental health issues are dangerous and that they should not be trusted. If society as a whole buys into the stigma that individuals suffering from mental health problems are inherently violent or conniving, many aspects of care and healing will be afflicted. Exclusion, isolation, and institutionalizing people will increase as a result of this idea. Current studies prove that these methods are harmful for patients. Stigmatization also responds to an individual's ability to understand treatment and when it is needed, where to receive treatment, and how integral treatment is to improving the quality of the individual's life. Of a study conducted in England, the main obstacles reported for people with anxiety issues were mistreatment, social distancing, stereotyping, lack of understanding, dismissiveness, and overprotectiveness. These obstacles would be difficult enough to deal with as a healthy individual. When people with anxiety disorders must face these difficulties alone, it can become extremely overwhelming and can compound their existing anxiety.